I'd like to welcome you to Doctor in the Making, where we will be discussing all topics related to medicine with the top influencers and doctors in the state of Florida.
Hi, my name is Dr. Josie with Write Your Acceptance, and I'm going to be answering some Q&A. Okay, so the question says it all, right? Not my thing. Research is interesting. Research is definitely not a prerequisite for medical applications, unless you're applying to MD, PhD programs. But it does look positive, right? Because it shows you have great work ethic, that you are intellectually curious, that you take initiative. So not your thing. I want you, I would say, to explore that a little bit. I've had students that have done psychology research projects. I have students who have done public health research projects who have gone out into the community conducting surveys. So it's not only wet lab versus dry lab, right? So if you're definitely not applying this cycle, you have that year to kind of think about it. Pursue other options that may fit more with, kind of are more in line with your interests. Seek out what psychology and science departments are doing at your school and local universities. You never know if you have opportunities elsewhere. Also check in with your student organizations and think about participating in undergraduate conferences, maybe not presenting just yet, but just kind of helping out. Sometimes not my thing kind of can translate to I feel uncomfortable in these certain spaces, and it's shaking off that kind of discomfort that you'll find your spot. So there's definitely a hierarchy for clinical experiences. I think number one is to find clinical experiences with direct patient contact. So a lot of students will tell me that they are a medical assistant, and the title sounds fantastic, but all they're really doing is kind of administrative work. So some schools won't consider scribing, for example, a relevant or a spicy clinical experience, because you are transcribing information. You're not directly contacting and adapting to kind of the needs of the patient. So I would say, students that have volunteered at assisted living facilities, at hospice centers. So anywhere that you have direct patient contact, where you are adapting to their needs, helping them feel comfortable. You're not treating them yet, but maybe you took vitals for the first time, something that you are kind of actively engaging with patients, that is number one. That's a tricky question, because if you are doing all the right things, you are gonna not only kind of draw the attention of one school, ideally you're drawing the attention of multiple schools, right? What I would say is you wanna think about kind of the application as a multi-dimensional jigsaw puzzle. So you wanna have a compelling personal statement, right? And we'll talk about that more in a bit. But you want to kind of think about, do the research, like, are you a good fit for this school specifically? Do your stats fall into their class profile? Are you telling your story as compelling as possible in the personal statement? Write exceptional secondaries, like really do your research, so that if you have a why us, like why do you want to attend the Miller School of Medicine, right? You really are kind of diving deep into the specifics of how you would learn there, how you would contribute there, and how it is a best fit. So too many times you want to kind of stay away from the splashy moment in your candidacy, in your application, and really just find those schools that you are a good fit for and that they feel like they're a good fit for you. This is a tough one to boil down, but I would say number one advice for personal statement is to tell your story to medicine. That sounds super kind of direct and simplified, but I see too many times kind of students will write 2 paragraphs on their journey as a single, as an only child, and then their sibling came when they were 13 and 14, and how that would kind of change their life, but they never bring it back to medicine. So remember that this personal statement, yes, it's your journey, it's your life story, but it's your life story within the context of medicine. Make sure that you're telling that every sentence, every experience, everything that you are mentioning in your personal statement is advancing your journey to medicine specifically.
Thanks for watching. If you like this video and you want to see more, click the like button below and follow me on Instagram at @DoctorInTheMaking_. Also, if there's a topic you'd like to see us talk about, make sure you let me know in the comment section below. And always remember, be grateful.